Hi, everyone. And this is a random podcast on our Leadership Academy based on some things that are going on currently in our American political system. And this podcast resulted on a question that I had for Tanya Miller. Tanya, thanks for joining me today.
Thanks, Sherry. I'm excited to be here today.
Currently, we're in a pretty volatile, divisive political state, and there's been a couple of decisions that have come down from the Supreme Court that have led to a an uproar. Is the best way I can put it in society, and I thought it was a great opportunity, and I wanted to ask you, how do you lead? What is the role of leadership in agencies when it comes to these politically divisive issues? And secondly, I wanted to let everyone know how I got to this question. As a user of social media, I've been seeing these posts and memes of companies that are providing some transportation and days off for folks that want to access healthcare that they want and need, that they choose to have. And what came to me was there nowhere on that list have I seen a healthcare company. And so, Tanya, why do you think there's no healthcare company on that list?
Sherry, well, that's a great question. I think traditionally, healthcare organizations have kind of always put themselves to the sideline. They're staying out of divisive conversations and, they're providing a public good. So they're really trying, to kind of say that old, leave home at home and work at work. And a challenge with that is that, you know, especially in the last few years with the pandemic and some other things that have happened that have caused some divisiveness in our society, that has oozed into our culture at our work. And by saying nothing, you're still saying something. So years ago, I thought about my own leadership, and I was always there's a line of what I don't do at work and keep kind of separate. And more, we have to be able to understand that we work within those societal changes and those societal waves, and that we need to be responsible as leaders and as healthcare providers to make statements and recognize that we operate within these societal waves and changes.
And Tanya, that is such a great way to put it. We are not immune to these changes that are occurring every day in our political system, and I think it's super important as we're getting a lot of information about the staff shortages and the lack of nursing and care services, care aid services for homebound patients and private duty companies, that we got to understand that culture is super important in our companies. And I like to use the quote, and I currently do not have the name in front of me to attribute this quote. And the quote is that culture eats strategy for breakfast. And I think that when you and I particularly, look at some of the dialogue that occurs on clinicians on some of the pages on Facebook and Twitter and Instagram, where the clinicians are speaking to each other, 9 times out of 10, the discussions revolve around culture. And these particular two very divisive issues that have occurred in the Supreme Court. One is Roe v. Wade being overturned and returned back to the states, and the other one is the open carry being allowed on a federal level. I want to address the second one first because it seems to be the low hanging fruit and the easier one to talk about. Having owned an agency in the South, we had to have a policy regarding firearms and our clinicians. Can you talk to me about what, as a former VP of a large home health agency, what would be your reaction to now finding out that federally open carry is allowed?
So again, here, this is where having crucial conversations and having honest, heartfelt conversations with your team is what's so important. Um, you know, just to back up a little bit, Sherry, you talked about culture eating strategy for lunch, and that is so true. You can have the most amazing strategic plans. I love strategic planning. So I get the value of them. But if you don't have the culture below that strategic plan to support it, it doesn't really matter. So this is where having a culture where you can have open, honest conversations to really talk about, okay, I understand what your rights are, but let's talk in general about the care of our patients and the safety and well-being of those around you. And let's have some common sense rules within our organization to support the safety of our patients and to support the safety of our team members and to create an environment where everybody feels accepted and safe. You know, being able to have those tough conversations in an honest way and being able to understand that people are going to differ in their opinions, and your goal is not to change opinions. Your goal is to find a new and creative solution together that everybody can feel like they understand and support. And that's really that where that really strong conflict resolution skills of leaders come into play. Um, Having that strong conflict resolution ability as a leader in these types of situations is crucial.
Absolutely. And understanding what the agency as a business is liable for in a situation of an open carry is super important as well. So I would also, piggyback what Tanya said and say that you need to get legal assistance with this. You need to discuss this kind of thing with an attorney, as far as how you would write your policies and procedures to protect your agency should you not be able to completely control what folks have with them when they go out to the house. That goes for just about any issue, but in the situation of an open carry firearm situation, I think that you need to make sure that you're protecting the interests of the agency probably above all else. And because if that went wrong, and Tanya, I've got my owner's hat on now. If that went wrong, what could possibly happen to the agency is what comes to my mind. Because ultimately, you have to keep the lights on, and you have to keep the license active, and you have to have a viable business to be able to support your employees. And so I think that that's something that you really need to put, as far as prioritizing how you're going to make that decision. Is that a fair thing to say, Tanya?
Absolutely, sure. That's a fair thing to say. But one of the things that I want to piggyback on that is kind of the gut reaction or the gut strategy that leaders may want to take, and I understand this, I'm very decisive and direct, is to put out a rule and to say this is the rule.
Hmm.
And that directiveness in an environment like this is just going to cause more tension and more conflict within your organization, which can create a toxic relationship, a toxic environment.
Right.
So that's where, even if you know what the outcome needs to be, having those conversations and working through the conflict resolution process to find a place where everybody can digest what needs to happen is going to empower you as an organization and improve your culture. So I really encourage organizations to not just put out statements and rules and policies, but to talk through these and get input from your team member and come out with a collaborative message so that people feel engaged in the process. That's how you build your culture. That's how you get to people to come to agreement on safety and doing the right thing for their patients and for the other employees.
Okay. And Tanya, I'm going to move on to the second decision that came out last week, where Roe v. Wade was overturned by the Supreme Court, and the decision making for the rope for abortion, went to the states. Each state is allowed to make their own rules, which is the reason for the meme that has been running around as companies jump on board with this transportation and PTO policy surrounding it. Why is that so important to think about and possibly discuss in our agency? What's so important about it? And I know you have some interesting statistics to share.
Yeah, so let's just first start to talk about our healthcare industry. And this is not a surprise to anybody in healthcare, but I think the numbers really help us to put our brain around this. So there's approximately 20 some million people working in healthcare. Of those 20 some million people, over 16 million of them are women. That comes out to 78% of the healthcare workforce. But when you look at decision making in healthcare, only 15% of CEOs in healthcare organizations are women. So let me put those statistics out there again. 78% workforce, 15% CEOs. So most likely the individuals making decisions in the healthcare arena are not directly, although indirectly they are, but not directly impacted by some of the changes around abortion rights. So I think it's really, really important to take a step back here and think about leading with empathy. We're going to have workforce individuals facing new challenges that were not challenges to them last week. And we need to be able to think about How do we lead and support them through empathy? And as a reminder, empathy is the ability to place yourself in someone else's shoes. So, no matter what your policies of your organizations are, as a leader, you need to be able to take that step back and see what someone is facing from their perspective. If a woman is having to make a choice of going to another state to have an abortion or make a hard choice because they can't do that, um, helping that person and walking in their shoes and their perspective is going to be so important to keeping a strong culture, engaging your employees, and supporting them when they need support.
I agree, Tanya, and I think that I go back to what you said about being silent. Choosing to be silent is as much a decision and as much as a statement sometimes as putting out a statement. And I think that, if we choose as the healthcare industry at large, not just home health, but the healthcare industry at large, I know that a lot of the professional organizations have come out with statements over the last week that have been very interesting. And I truly recommend that everybody go and look at what the AMA, the APTA, the American Pediatrics Association, all of these large organizations that represent our medical professions have had to say in the last week that would help you inform you where, as an industry, things are going. I think that sometimes just the acknowledgement of the issue is enough to let your employees know that you're actually listening, that you actually know that there's something going on out there that probably needs to be addressed. But by completely being silent on the situation, don't you feel, Tanya, that that is as much of a statement as actually making a statement?
Oh, absolutely. Silence is a statement. So
Mhm.
by saying again, um, you know, we're in this social wave of change, and kind of the approach has been, oh, we're just not going to say anything that's not in our preview to say. That's not a reality anymore. So you saying nothing and just not participating in the process is still saying something. And I think it's really important to look at recruitment and retention. They are the biggest issues facing healthcare providers today. And I'll go back to the numbers. 78% of your workforce are women. So you as an organization need to think about, what are you saying and what are you doing, and how do you want to come across to that potential employee and to your current employees? Because they have a lot of choices right now, and they are going to make choices about their employment based on organizations that align with their belief systems.
Mhm.
So it's really important to understand, who do you want to align with and how do you want to utilize that to recruit employees.
And Tanya, as we finish, I wanted to go back to those statistics that you just mentioned again. 78% of our workforce is women, but only 15% are CEOs in the healthcare space. That's one of the reasons why you developed this leadership academy, right? Was to help that number change.
Absolutely. I mean, the individuals taking this academy are usually frontline leaders or director level leaders. And my goal is to really give you the skill sets to continue to develop and grow your career. And I love the fact that this program has been taken by many women. And I hope that they've gained skill sets to help them continue to rise, because we need to balance out those numbers. We need to have more women represented in leadership of healthcare, so that and our leadership reflects the employment of healthcare industry.
I 100% agree. And I hope that this podcast has helped some of you that may be struggling with this difficult conversation and where to start. I think that my takeaway from this is to listen to your folks with empathy. I think empathy is the biggest thing. Understand where they're at, and also just be comfortable in the fact sometimes with these difficult conversations, there is no right or wrong answer. No matter what decision you make, it will have an impact on your culture one way or the other. And so balancing that out and having that ongoing dialogue with the folks that work with and for you is super important, that you get it to the point that your culture is not impacted negatively. So I kind of want to leave everybody with that. Culture eats strategy for breakfast. And so your culture needs to be protected, and that can only happen with ongoing dialogue. Tanya, did you have any closing statements?
Sherry, I just want to jump off of what you said too. using empathy at times like this is empathy is always important, but using empathy at times like this when people may be facing increased difficulties within their life is so important. And also remembering that conflict resolution skills are incredibly useful as leaders, and you need to continue to develop them and find new and different ways to resolve conflict.
Thank you, Tanya, for getting on this podcast with me. And if anybody has any questions or has any other topics that they would like for us to discuss as part of our Leadership Academy, please feel free to reach out to us at www.valuebeyondthevisit.com. I'll say that a little slower, www.valuebeyondthevisit.com. And just look up Leadership Academy and we can get you any information and or podcast on any subjects that might be important to you. Thank you so much, Tanya. I really appreciate it. And until next time, everyone have a wonderful day.
Sherry.